I'm standing at the witness stand in a hospital conference room, my voice shaking as I read from my written statement, when the risk management director interrupts me for the third time. Mrs. Chen, we understand you had a difficult birth experience, but I cut her off. No, I say, my voice louder than intended. You don't understand. I screamed. 5 separate times, I screamed that something was wrong, that you needed to stop, that I needed help. And every single time, I was ignored, dismissed, or told I was overreacting. So please don't tell me you understand when your staff's systematic refusal to listen resulted in injuries I'll live with for the rest of my life. The room goes silent. And I think about how I used to be someone who never raised her voice, who trusted medical professionals. That person died in the delivery room 7 months ago. I got pregnant at 29 after 2 years of trying, and it felt like a miracle. The pregnancy was textbook perfect. I'm a dental hygienist, so I understand medical settings, the importance of listening to patients. I chose my OB carefully, Dr. Reynolds, who emphasized patient-centered care. Communication is the most important thing, she told me. If something doesn't feel right during labor, you speak up immediately. We're a team, and your voice matters. I believed her completely. I trusted that in a modern hospital, if I said something was wrong, people would listen. That trust almost cost me my life. My water broke at 38 weeks and 4 days, around 10 p.m. on a Tuesday. Contractions started within an hour. We arrived at the hospital around midnight, and I was 4 centimeters dilated. The labor and delivery nurse was Tiffany, young and friendly. Everything seemed routine. They got me settled, hooked up monitors, and I labored naturally for the first few hours. By 3 a.m., I was 6 centimeters and feeling strong. And then something changed. The contractions suddenly felt different, not just more painful. The contractions suddenly felt different, not just more painful, but wrong, like something inside me was tearing. That was the first time I screamed. Something's wrong, I shouted during a contraction, a ripping sensation in my lower abdomen that felt nothing like normal labor. Something's tearing. Tiffany came in looking annoyed. Labor hurts, she said flatly, checking the monitor without looking at me. You're in transition. This is normal. You need to breathe through it. I tried to explain that this was different, but another contraction hit and I screamed again. Please, something is wrong, I need the doctor. Tiffany sighed, actually sighed. The doctor is with another patient. Your baby's heart rate is fine. You're fine. First-time moms always think something's wrong when they hit transition. Just breathe and stop screaming, you're scaring the other patients. She left the room. Looking back now, I know what I was feeling. My uterus was beginning to rupture. But because I was a first-time mother screaming in pain, Tiffany decided I was just being dramatic. 20 minutes later, the pain had become unbearable and constant, not following normal contraction patterns. I was screaming with every breath, and that was the second time I screamed for help. My stomach is tearing apart, I can feel it, something is seriously wrong, I need the doctor now. Tiffany looked at the monitor again with that same dismissive glance. Your baby's heart rate is still normal. You're probably experiencing back labor. Let me check your cervix. She checked me, 7 centimeters. See? You're progressing fine. Do you want an epidural? An epidural. She was offering pain management when I needed emergency surgery. I don't want an epidural, I want someone to listen to me, I sobbed. This isn't labor pain. Tiffany's expression became hostile. Mrs. Chen, you need to calm down. Your hysterics are affecting your baby's heart rate now. If you can't get control of yourself, we'll need to consider interventions. My genuine medical emergency was being framed as emotional instability. I tried to calm down, tried to trust that maybe I was wrong. But another wave made me scream again. That was the third time. Something is ripping inside me, Get the doctor, please. My husband David was shouting too, demanding someone call the doctor. A different nurse came in, older, Patricia. She looked at Tiffany with an expression I couldn't read. What's her pain level? Patricia asked. She says 10 out of 10, Tiffany said with an eye roll. But she's been saying that for an hour. First time mom, not handling transition well. Patricia checked the monitor, then actually looked at me. When did the pain pattern change? She asked directly. About 45 minutes ago, I gasped. It went from contraction pain to constant tearing pain. Patricia's face changed. Page Dr. Patterson's stat, she said to Tiffany. Now. But even with a stat page, Dr. Patterson didn't come immediately. 15 more minutes of me screaming that something was tearing. When Dr. Patterson finally walked in around 4 a.m., I was barely coherent, and that was the 4th time I screamed. My uterus is tearing, I can feel it, something is ruptured, please help me. Dr. Patterson checked the monitor first, not me, the monitor. Baby's heart rate is showing some decelerations now, he said calmly. He checked my cervix, I screamed from the pain, and said, 8 centimeters. You're almost there. Let's see if we can get you delivered vaginally. Almost there. Like I should push through catastrophic internal injury. I can't push. I'm telling you my uterus is rupturing. Dr. Patterson frowned. Uterine rupture is extremely rare in first pregnancies. You're experiencing severe labor pain. Let's manage your pain and see where we are in an hour. An hour. He wanted to wait an hour while my uterus was tearing apart. Patricia pushed back. Doctor, she's presenting with constant severe pain, change in pattern, and now fetal decels. Shouldn't we at least do an ultrasound? Dr. Patterson looked annoyed. If you're that concerned, we can prep for a C-section, but I think we're looking at a pain management issue and maternal anxiety. Maternal anxiety. My uterus was rupturing and he diagnosed it as anxiety. Prep for a C-section then, Patricia said firmly. Finally, action. But even as they rushed me to the OR, I could feel myself getting weaker, feel something hot and wrong spreading through my abdomen. That was the 5th time I screamed as they wheeled me down the hallway. I'm bleeding inside, please hurry, I'm dying. A nurse walking alongside actually shushed me. You're going to be fine, honey, try to stay calm for your baby. I don't remember much after that. What I learned later is that by the time they opened me up, my uterus had fully ruptured. I was hemorrhaging into my abdominal cavity. My son Christopher was in distress. They got him out 6 pounds, 2 ounces, born not breathing, requiring resuscitation, and then they had to stop me from bleeding to death. I needed 4 units of blood. They had to perform a hysterectomy because the damage was too extensive to repair. At 29, having just given birth to my first and now only child, my uterus was removed while I was unconscious. Christopher spent 5 days in the NICU, and is fine now, thank God. But I woke up 2 days after delivery to learn I'd nearly died, that I could never have another child, and that all of it could have been prevented if someone had listened the first time I screamed. The hospital's initial response was unforeseeable complication, appropriately managed once diagnosed. Unforeseeable. As if I hadn't spent an hour screaming. When I demanded my medical records, Tiffany's notes described me as anxious first-time mother, low pain tolerance, unable to cope with normal labor. Patricia's notes documented sudden onset constant severe pain, patient reports tearing sensation. Dr. Patterson's notes said emergent C-section appropriate due to fetal distress and possible uterine anomaly. Not patient's accurate self-diagnosis. My screams weren't documented. The delay wasn't explained. It was all sanitized into a narrative where they were heroes, not staff whose dismissiveness nearly killed me. I spent 3 weeks in the hospital recovering. Christopher was home before I was. I missed the first 2 weeks of his life fighting to survive complications that shouldn't have happened. 7 months postpartum, I still have chronic pain. I can't stand for long periods, which means I can't do my job anymore. I'm on disability, we're drowning in medical bills, and I live with the knowledge that I'll never give Christopher a sibling. The emotional trauma is worse. I have nightmares where I'm screaming and nobody comes. I have panic attacks at medical appointments. I have rage at every person who heard me scream and decided I was being dramatic instead of dying. I hired a medical malpractice attorney. My case is still pending, years of litigation ahead. The hospital's defense is that uterine rupture is rare in first-time mothers, so it was reasonable to consider other diagnoses first. As if an hour of me screaming the accurate diagnosis wasn't enough information. Here's what I've learned: you can scream until your voice gives out, and it won't matter if the people who are supposed to help you have decided you're being dramatic. The maternal mortality rate in the United States is rising not because pregnancy is getting more dangerous, but because medical professionals aren't listening to pregnant patients. We dismiss what women tell us about their bodies. We assume hysteria before crisis. And by the time we finally take patients seriously, it's often too late. I'm alive, and grateful. Christopher is healthy and perfect. But I'm also permanently disabled, unable to have more children, traumatized, and bankrupt. All because 5 separate times, I screamed for help and was ignored. I attend support groups now for birth trauma survivors, and nearly every story includes I told them something was wrong and they didn't believe me. We compare notes on how many times we had to scream. We've all heard labor hurts, you're being dramatic, first-time moms always think something's wrong, you need to calm down. We've all been told our accurate descriptions were just anxiety. And we've all lived with the consequences. The support group leader says, your voice matters. Your pain matters. What you know about your body matters. But the medical system doesn't agree. I speak publicly now, testifying at hospital board meetings, talking to prenatal classes. Not to scare people, but to teach them, if you say something is wrong and staff dismiss you, escalate. Demand the charge nurse. Demand the attending physician. Demand a patient advocate. Say clearly I do not feel heard and I need someone else immediately. Document everything. Refuse to be characterized as hysterical. Use specific medical language. Say I'm concerned about specific condition. And understand that even if you do everything right, you still might not be heard. Because the problem isn't that patients don't communicate well. It's that medical professionals, particularly in maternity care, have been trained to expect women in labor to be emotional and unreliable narrators. Until that changes, people will keep screaming and keep being ignored. Christopher is 7 months old now, happy and healthy. But every moment of joy is tinged with grief for the children I'll never have, for the body I'll never get back. Some days I'm okay. Some days I stand in my kitchen and remember the hour I spent screaming while nobody listened, and the rage is consuming. Both things are true. I'm grateful we survived and furious at the negligence. I love my son and I'm traumatized by his birth. I contain multitudes, and all are valid. If you're pregnant, especially if this isn't your